There are many different ways to consume medical cannabis. These are called delivery routes or delivery methods. Now, here in Florida, the state registry is broken down into a few different categories, and they've created some of their own where there's a lot of overlap. So for the purpose of the registry, you're going to see that there's inhalation, sublingual, oral, topical, suppository, and smoking. Each delivery method produces a different result, a different effect, and they all have different onset times and durations. So most patients will actually use a combination of different delivery methods to get medicinal benefit throughout the day in the ways that fit best for their personal lifestyle and their symptoms and their condition. You'll need to experiment to figure out which delivery method works best for you, but it's really important to understand how they're different and how they might best be used. So that's what we're going to cover today. The first and most popular category is inhalation. Now, Florida's a little backwards when it comes to inhalation, and they've created smokable cannabis as its own separate category. While Florida law separates smokable cannabis from inhalation, smoking cannabis is a form of inhalation. So we're going to break down some of the differences between smoking and vaporizing. Smoking is the act of combusting cannabis, meaning you are lighting it on fire. Now, when you do this, you are going to actually destroy a lot of the medicine, and it does produce byproducts in that smoke. So from a medicinal perspective, we're always going to encourage you from an inhalation point to vaporize before you smoke your medical cannabis. So let's talk a little bit about vaporizing. Vaporizing is different from smoking in that it heats cannabis just to the point of boiling. It doesn't actually combust that medicine or light it on fire. This allows you to get much better control over the terpenes and the cannabinoids that you're consuming, and tends to have less irritation to the lungs and throat that's experienced with smoking. Now, some patients do find that the experience of vaping is different than smoking. A lot of patients will tell you that they respond better to smoking for certain symptoms, especially things like appetite or GI. So every patient has to experiment and find out what works best for them, but from a medicinal perspective, we're always going to encourage you to vaporize your flower before you smoke it. Inhalation provides for a very quick onset. Most patients feel effects within a minute or so of taking in that inhalation, with effects lasting anywhere from 1 to 4 hours or so. That duration and onset is largely dependent on the patient, their tolerance and experience, as well as the strain or the product that they're inhaling. While vaping does eliminate some of the potential risks of smoking, it works just as quickly and just as fast. When you inhale a vaporized cannabis, you will feel that just as quickly as smoking cannabis. The benefit of inhalation is that it allows patients to titrate or dose themselves up really easily. Because you feel those effects so quickly, you can take one inhalation, wait 15 minutes or so, and see how you feel. If you need more, then add one more. There's not an extended period to wait, so it's really easy to kind of dose up and figure out what your sweet spot is. That said, it's also really easy to overdo it. It's so easy to just take an extra inhalation, so you need to be really mindful and give yourself a chance to actually feel that medicine so that you don't overdo it and start to build a tolerance when it's not necessary. Because of this really quick onset and short duration, inhalation is best reserved for managing breakthrough symptoms, meaning those symptoms that pop up throughout the day and not necessarily a main medication method. There are other options for medical cannabis that will provide much longer and more stable relief so that you're not having an up and down roller coaster of symptoms. Now, with inhaling cannabis, whether you're smoking or vaping it, you do not need to hold it for an extended time period. This is something that's been passed on kind of through stoner culture, and it's really unnecessary. All you need to do is take one inhalation in, make sure that you actually get that into your lungs. So for some patients, it's easier to think about it in two parts. One to get that into your mouth and a second to get that into your lungs. Once it's in your lungs, you can go ahead and exhale it. You do not have to hold it for an extended period of time. Sublingual is the next delivery method. Now, this is the act of administering a cannabis medicine under your tongue or through the mucous membranes of your mouth. Here in Florida, we have very few products that are actually a true sublingual administration. This is really important to understand because throughout the cannabis market, you will see products that are labeled as a tincture, a sublingual tincture, but they are oil-based. Now, when you put oil under your tongue, it will eventually start to turn to saliva and you're going to go ahead and swallow that all. Those oil molecules are a little bit too big for it to really be absorbed well into your bloodstream. Now, a true cannabis tincture is made from ethanol. And ethanol or alcohol will burn when you put it in your mouth. So if you take a tincture and it burns, that is a sign that it will actually work in that way. Now, when you apply a true tincture to your mouth or to the sides of your mouth, so there are sprays that work in the same way, this will work rather rapidly. Depending on the product and the person, it could be anywhere from a few minutes to about 15 minutes. And then the duration is typically about 3 to 6 hours. Now, we really like this method for providing longer relief, and it's a lot more stable that you will get 3 to 6 hours of steady relief instead of that up and down of having to inhale frequently. So for most patients, we really encourage taking a tincture or the next option, an oral oil, as your main method and using that inhalation as needed for those breakthrough symptoms. Oral delivery or oral dosing is the act of swallowing a cannabis medicine. Now, with all cannabis, low and slow is really important, but this is extra important with oral dosing. If anyone has crazy stories when it comes to cannabis, it usually involves cannabis brownies. And this is because when you eat cannabis, it takes a really long time to kick in and it's really variable. It can be 30 minutes, it can be 2 hours. If you're like me, it's 30 minutes one day, 2 hours the next, 4 hours the next. So patients often get impatient and eat some more. And what ends up happening is that dose compounds and then they're really, really intoxicated. So I cannot stress enough. Low and slow is the way to go, especially with any cannabis that you eat. Now, oral dosing, like I just mentioned, can really vary on the onset time. It's usually about 30 minutes to 2 hours, but people with GI conditions or those who do not have a gallbladder might find a lot more variability than the next person when it comes to digesting this. Consuming oral cannabis with added fat will help you absorb more of it, up to 5 times the amount. Now, it's extra important, like I mentioned, I cannot stress it enough, to take this low and slow because the duration of the effects are also very long. They can stick around for 6 to 8 hours. So you are far better off not taking enough and trying again the next day when you're still figuring it out than taking too much and being way too uncomfortable for such a long time period. Now, while these effects can be intense, that 6 to 8 hours can provide significant relief once you find that perfect dose. This is extra applicable when it comes to pain conditions. The way that cannabis is processed through the body when you consume it orally kind of changes the potency, so to speak, and makes it feel much more body heavy. It's definitely a much more body-centric feeling, and the high or the euphoria can be a lot more intense. This is great for people with chronic pain conditions, but again, needs to be used appropriately and with caution. It's also a great medication option for those that struggle to sleep through the night. That 6 to 8 hours of benefit is a full night's sleep often for patients who toss and turn and are lucky to get a few hours. And as a cannabis patient, one of the first things that we can do is work on sleep, because when you get your sleep feeling better, then everything else tends to fall into place. So I'm not trying to scare you away from oral dosing. I'm just trying to really encourage you to take it slow, take it cautiously, and do it the smart way. Now, the exception to any potential negative effects with oral dosing is when we consume raw cannabis flower, or what we call THCA. Now, cannabis has to actually be heated to experience those psychoactive effects. That's why anything that's been made into cannabis for eating has actually been what we call decarboxylated first. That is changing that form from THCA, dropping off that A molecule and turning it into the THC that I've been describing this whole time. Now, THCA should not be overlooked. It has tons of potential medicinal benefits, including its role as a very, very potent anti-inflammatory. So if you've heard us tell you or encourage you to eat the raw flower, it's for that reason. And you do not have to take those same precautionary measures when it comes to consuming that raw flower. Because it has not been decarboxylated, it will not get you high. The next delivery method is topical and transdermal. This is one of my favorite areas, and I really start to geek out when I talk about this stuff. Cannabis can be super effective applied right to the skin. You don't even have to inhale or eat it or consume it in any way like that. And I love this method because it does not get you high. There are no psychoactive effects when you're using a local topical. That's because the THC and CBD molecules are just too big to actually get into the bloodstream through your skin, but it will get into the endocannabinoid receptors in those areas and provide localized relief. This can be great for chronic pain conditions, and this includes all types of pain. I use it regularly for nerve pain, for inflammatory pain, and muscle pain, muscle spasms. It can release those muscle spasms quite quickly. Now, there are transdermal methods as well. Transdermal methods can have some psychoactivity, but it tends to be reduced compared to those other methods. Transdermal methods are typically a patch that you apply to a vein or a gel that you apply to a veiny area. Now, when you apply these patches or gels to a vein, it will work through your whole body, giving you a systemic approach. But some patients have found that you can actually use these locally as well. So when I get a really bad muscle spasm, I get muscle spasms and knots in my neck a lot, I'll go ahead and slap on a patch to that area, and it'll work like a topical for just that local area, but for an extended time period. A lot of these patches can last anywhere from 12 to 72 hours. So for patients who either need that reduced psychoactivity, need to medicate in a really discreet way, or just need that added layer of stability for a long-term period, a patch or a transdermal method can be a great choice. So onset and duration of topical and transdermal methods vary. Typically though, it's onset within about 20 minutes. Topical creams typically last about 4 hours or so and can be reapplied as needed, where the transdermal products really vary based off of the specific product. Like I mentioned, patches can be anywhere from 8 hours at times to 72. So you'll have to check the specific product that you purchase to see just how long that product is expected to work for. Now, as I mentioned earlier, smokable cannabis is not really an accurate term, but it's what Florida did when they made it legal for us about a year ago. Now, cannabis flower can be used for all different methods. You can actually use that cannabis flower to eat it raw, like I already mentioned, or make your own tinctures, make your own edibles in oral dosing, or make your own topical creams. So don't get stuck just by that smokable label here in Florida. Feel free to learn and experiment and find out all of the valuable things that that flower has to offer. Like most medicines, cannabis takes experimentation. It takes some trial and error. So the more you experiment with these different delivery routes, the more you'll kind of figure out what works best for you. A lot of patients find that they do really well with a tincture or an oral dose 2 to 3 times per day to provide kind of that stability, and then use inhalation as an add-on method for any breakthrough symptoms that pop out throughout the day. Other patients prefer to avoid inhalation altogether and just use oral means. Some patients use all of the methods. That's me. I, on any given day, might use oral dosing, inhalation, topical, transdermal, sometimes even suppository, which I completely glossed over in this video and need to go back to. So suppository is obviously not the most common method of delivery here in Florida, but it is available. Now, we don't include this on every patient's recommendation, but we will absolutely include it if you ask us to, or if we talk about it and recommend it for you in the first place. Now, suppository methods really vary. They can be used vaginally or anally, and typically do not have psychoactivity on the same level as other products. Its research is mixed on that, and patients even give mixed reports, but generally thought to not be very psychoactive. It's typically used for chronic pain conditions in the pelvic region, as well as patients who are just too sick to consume cannabis in other ways. Onset time is typically within about 20 minutes or so, and that duration can really vary. We don't know a lot about suppositories yet, and it seems to be really person dependent, but it is absolutely a method out there. So what I really want you to take home from this video today is a little bit about all of those delivery routes, but that the magic of cannabis happens when you figure out what your personal mix is, what your sweet spot is, and what the right combination of those delivery routes, along with cannabinoids and strains and the right cannabis product, to get your perfect match.